My name is Quinton Friesen, and this is Module 7 of 15 in 4 Essential Disciplines, a training guide for healthcare leaders worldwide. My colleague Ken Hekman and I are leading you through 15 modules to help you improve your knowledge, skills, and attitudes as a healthcare leader. In this session, we are going to discuss planning, that is, looking at our current circumstances and anticipating the future. In the book Alice in Wonderland, Alice goes through the rabbit hole and comes upon the Cheshire Cat, who asks Alice, "Where are you going?" Alice responds, "Nowhere in particular," to which the Cheshire Cat responds, "Anywhere will get you there." Many organizations or departments have this attitude. We haven't said where we are going, and so there is no way to measure whether we've arrived or if we are making any progress. Our learning objectives for this session are to understand 5 steps to developing an organizational plan, to know various techniques to gain planning information, to know how to assess your organization's condition, to understand the synergy of mission, vision, values, and goals, and be able to write SMART goals.
The first step in developing an organizational plan is to look at the environment within which the organization is functioning. You will recall that one of the skills discussed in Module 2 was scanning, and in Module 3 we discussed the fishbone diagram for root cause analysis. We want to assess unmet community needs, volume of services provided, and assemble facts needed to develop our strategic plan. Fundamental to our plan is the mission, vision, and values statements defined earlier. As a first step, we will want to scan various stakeholders to assess their needs, wants, and expectations. Potential stakeholders include patients, individuals who are not yet patients, families of patients, owners, investors, and government officials, community citizens, doctors, staff members, and volunteers. We will also want to look at disease prevalence data. Are there particular diseases prevalent in your community, or are there potential threats to the health of your community? How often does this disease occur? Are there other alternative caregivers, and so forth? With this information, we will be able to assemble a listing of the medical programs required meeting the needs of the community. For example, how many patients will be admitted? How many beds will we need? How many babies will be born? How many obstetric beds will we need? How many patients will require surgery? How many operating rooms will we need? Will patients need outpatient services? How many exam rooms will we need? You can see that the volume projections provide the basis for our strategic plan. They will also form the basis of assembling our projected revenue and expense budgets. Sometimes the Ministry of Health, the World Health Organization, and other researchers can provide vital statistical information forming the basis of your plan. Our plan should include information on our competitors and the unmet needs of our community, the types of services required, and the medical programs that we expect to deliver, volume projections, financial projections based on the volume of patient revenues and expenses required to care for the patients, the staff required to provide services to the patients, an overview of the facilities and equipment required for patient care. In summary, we want to assemble a fact sheet that provides the context in which the organization is functioning, a snapshot of the community.
Once the management team has assessed the environment within which the organization is functioning, it is important to assess the organization's ability to meet the unmet needs and expectations discovered in the environmental assessment. In Session 2, we discussed the SWOT analysis, and in Session 3, we discussed the fishbone assessment techniques. Both of these techniques will now be brought into play to assist in assessing the organization. Market needs assessment, for example, it has a community, outward focus. The SWOT analysis can assist us in looking at our organization in the context of our community. It can be focused outward, or it can also be focused inward. Strengths, weaknesses, opportunities, and threats. The fishbone diagram, cause and effect diagram, helps us to resolve an obstacle or identified issue. In a short period of time, management teams can quickly assess the organization's competitive position and how the organization meets the needs and expectations of its customers and patients. In summary, market needs assessment, community outward focus, SWOT assessment, its organization, inward or outward focus, cause and effect diagram to analyze a given issue.
In Module 3, we introduced the concept of mission, vision, and values. Now we are going to incorporate these into our plan. For a strategic plan to be successful, it needs broad input and leadership buy-in. Leadership ownership is vital to successful plan writing and implementation. Leadership includes the lead person and the entire leadership team. They are unifying the organization, and they are responsible for pointing the way to the future. Over time, leaders will want the entire organization, from the board of directors to the laundry staff, to buy in and support the plan. A mission statement completes the sentence, "We exist for the purpose of." It answers the question, who are we? You will recall the illustration of the organization discussed in Module 3 that was formed for the purpose of caring for the sick and injured, providing medical education, and conducting medical research. In 150 years, the purpose had not changed. A vision statement is a statement that carries us forward, a statement that motivates us to move forward. It creates a mental image of the future. For example, you will recall Henry Ford Hospital's vision, transforming the lives and communities through health and wellness, one person at a time. And values statements answer the question about how we will conduct ourselves. As the organization buys into these concepts and key statements, their power to move the organization becomes evident.
The mission, vision, and values serves as a strong foundation for our plan. We need now to write goals that will guide the organization's activities. The dictionary definition of goal is an object or end that one strives to attain. Goals guide the organization's activities over time. Goals tend to be 3 to 5 years in duration, but can continue for long periods of time. There are 5 attributes to well-written goals. They are referred to as SMART goals. S means specific, M, measurable, A, attainable, R, realistic, and T, timely. Once the goals are written, specific action plans or objectives are written for each goal. They will also be written in the SMART style. For example, let's look at a cardiology department goal. A major goal was to provide cardiology services that are responsive to the community, patients, physicians, and staff, consistent with the hospital's mission statement. By providing 5 community wellness and screening programs to 1,000 senior citizens living in our community by December 31st of this year. A second action plan would be to purchase 1 nuclear cardiac scanner at a cost not to exceed by November 1 of next year. In another hospital, goals included to be the provider of choice, to be the employer of choice, to be the quality provider, and to be financially sound.
The organization then wrote specific SMART action plans to outline how the organization was going to achieve the goals noted above with specific timelines for completion. Action plans are very specific, explaining exactly how the goal is to be achieved. In another organization, goals in the following areas were written: goals for programs, equipment, facilities, employees, marketing, quality, leadership, processes, and fiscal.
This diagram provides a conceptual framework of how all of these items work together. The strategic plan challenge is to identify the unmet needs and expectations of our patient and community. The plan will include medical programs, projected volumes, staff and facility needs, and financial projections. Once completed, it will provide a roadmap into the future, guiding long-term and day-to-day actions. You can see how important the mission and vision statement is. It provides a point on the horizon that you are pointing the entire organization toward. They will help you deal with the distractions of every day while keeping you on course, achieving your reason for existence. Rensis Likert developed the concept of a linking pin organization. The idea was that an organization has overlapping work groups, and there are individuals who work in these overlapping work groups. In each work group, these individuals who work in the overlapping work groups might be a nurse, for example, who works in the nursing department, but also heads up the cardiology department. Likert referred to these individuals as linking pins, thus the linking pin theory of organization. The role these staff members filled would be communicators, communicating both up and down the organization. We've taken this concept and imagined how we could use it to focus the entire organization. One organization developed a mission, vision, values, and goals statement in each department from top to bottom, beginning with the administration, working through each additional department, thereby linking the entire organization together. With mission, vision, values, and goals written in every department across the entire organization from top to bottom, we were able to gain focus on the overall organization's mission and vision. This diagram illustrates the concept of a linking pin organization. You can see the overlapping work groups represented by overlapping triangles. These begin with the administration and then proceed through the entire organization.
A well-written strategic plan also includes financial projections to assure that the plan is feasible and that the organization is sustainable. In Module 11, we will talk about organizational financial requirements to assure sustainability. In summary, we have discussed 5 steps to writing a strategic plan. First, identify needs and expectations of stakeholders. Assess the condition of the organization. Articulate the organization's mission, vision, and values. Develop goals and action plans. And then develop financial plans and budgets. Now let's look at a few common questions related to planning. We can't get accurate data from our government or other sources to help us plan based on community needs. Where can we start?
Start with your own broad estimates about community needs. For example, let's say you want to estimate how many women of childbearing age live within your market, so you can plan a maternity service. Estimate the range with a high number and a low number, then look for evidence to narrow your estimate to a more rational number that you can use as the basis for planning. The goal of gathering data for planning a new service or for expanding an existing service is to reduce the business risks associated with the investment of resources. If data is difficult to find, you have to improvise first, then refine and validate your assumptions over time.
We have tried to set goals in the past, but they usually get changed because of unexpected challenges. How can we make goals that can make a difference?
Often goals are soft. They are unwritten, nonspecific, with no one identified as being responsible for implementation. Develop SMART goals and be clear about the action steps required to implement them well, and the people who are responsible for each step along the way. Planning requires diligence and discipline to be effective. Anything short of that is merely wishful thinking. Planning is a major function for leaders and managers. You may want to apply some of what you have learned today with an exercise by practicing how to write SMART goals. Develop a goal for one of your projects that is specific, measurable, attainable, realistic, and timely. This concludes Module 7 of 15. Thank you for listening.